Thank you very much. Thank you for inviting me. It's a pleasure to be in Arab Health, and I'm delighted to be with you. We will concentrate today in the talk of today in how can digital health innovation help reach the SDGs, as you know, the Sustainable Development Goals, and save lives in the COVID-19 pandemic. This is Dr. Jordi Serrano-Pons. This is the CEO of Universal Doctor, the digital global health company. And this is a company that was set up at least 10 years ago in Barcelona area. It was born because of a necessity, which is also always important. That was a linguistic necessity. We developed Universal Doctor Speaker, which was a translation tool that was quite successful. But also then we kept moving into that space. That's why we call now the digital global health company. We've been collaborating a lot with the WHO, World Health Organization, and many other institutions. And myself, as in a personal way, I was a consultant during 3 years there. We've been working in the global space, developing chatbots as our initial pathway was the healthcare translation tools, but also we have been developing tools for third parties in collaboration always with these global health institutions, and we have been able to implement our tools in more than 30 different countries, and so on. And in that moment, we find ourselves with a portfolio of more than 25 tools, concretely in the space of global health, and right now developing this kind of Lego approach of developing different system blocks and fitting them to implement tools that help with the SDGs in general. As you know, WHO has a $3 billion target. The WHO wants to reach 1 more billion people that have access to universal health coverage, 1 more billion people that are better protected for emergencies. In this case, we would find ourselves now in the COVID time. So these organizations want to achieve this kind of objectives, and in general to have also a 1 billion more healthier population. That would mean to use all the technologies to prevent instead of health, of healing, no, in that sense. It's important to understand that there's many dashboards and that are already interconnected, and basically the objectives are always bigger than the real outcomes. So it's important to see how we can improve all these outcomes with the digital health technologies. No? There's a small homage to these organizations, because these last 6 months they have been working so hard, and I think they deserve the tribute of all of us for trying to help all the governments, which is not an easy task. As you know, the United Nations are composed of 194 countries, and if it's sometimes difficult to develop policies and implement innovations within one own government, imagine how to do things trying to make happy 194 different governments. It's almost impossible. As you know, for some of you, if you still don't know, the SDGs are 17 different goals, which the ones that are that attain to our talk are the goals number 3 in general, which is good health and well-being. But of course, many of the others sustainable development goals are totally in line with the things that we're going to talk today. The more poverty the neighborhoods have, the more likely is the risk of contagion, of the risk of getting COVID-19, because of lack of open space, lack of enough room, close contact between the same inhabitants of the same building, and so on. So all the sustainable development goals are quite related, no? The more well-educated, it will be easier to really know which information is important, which fake news are circulating, which things have to take into account, and so on. No? So every single aspect of the SDGs is important. The same with gender equality and so on. Not many other things. Climate change is one of the most important ones, as we consider that the rise of the temperatures will produce likely many more outbreaks in the future, or will make change in the mapping of the disease. We expect soon, very soon, autochthon malaria cases in Europe, which was for more than 20 years, at least, or 30, 40 years, in Greece, Spain, Portugal, no more, even 60 years, no more case of malaria. It's expected that malaria will come back if the tendency of climate change continues. No? So all these are important things. Technology, it's super important. Digital health, it's super important. But what is really important is the collaboration between research centers regarding the vaccination process. There is a huge initiative called COVAX, which has been promoted by CEPI, which is a coalition for epidemic response, rapid response, which is being led basically by Norway and other countries and big institutions. And the COVAX response is CEPI plus WHO effort, plus also the implementation part of UNICEF, which that COVAX coalition will allow countries to concentrate in collaborating together and not fighting each other for the number of vaccines. So there is a complex structure where the pharma innovators, the people who are developing the different vaccines, are engaged in this COVAX initiative, and they guarantee a number of doses that are secure for COVAX and not for a specific country. This is a good response effort, and this is very important. Before doing all the other things, that effort is very important. Obviously, it's very important to have a holistic vision of innovation and how digital health is the spinal cord of these many different innovative approaches. No? This is a graphic of 2007. I would like to share with you. It's 3 years old. It seems for me 20 years old, because it's a graphic that I like to show quite often in the conferences, because there was a graphic developed within a weekend by family doctors, GPs, and cardiologists in America and United States, that were worried about the huge number of new terminology, of new concepts that, like a tsunami, no, they were not able to cope with. No, and it's true that many of these terms are maybe easy to, for example, artificial intelligence. But if you ask to a family doctor or a GP, describe 5 of these terms with a good description, no? That it's a problem for many of them, no? Because they don't know, many of them, they don't know what is an exposome, or they don't know what is a lab on a chip, microfluidics. And it's important to see that all this terminology, it's totally related with what has to do microRNA with microfluidics, or with bioinformatics, or with natural language processing, a lot. And all these concepts are important to have into account, because the innovation capacities are there, but sometimes are within different silos. No? And it's important that people from labs that are more in precision health can talk with people of digital health that are more in the field, testing new devices, new apps, new webs, and also with people that have to then analyze the data. No? We have now, as ever before, all the building blocks. We have amazing bio-test capacity of making tests. We have a lot of devices that can collect data, and then we have the capacity analysis of doing knowledge of this data. No? Because the data, if it's not transformed in something knowledgeable, it's useless. No? It's important to have things in account. in the concrete case of today, the digital health possibilities in pandemic's time, I think there have been many initiatives, but as you can see these days, right now I am making this conference from Barcelona. I spare my time between Geneva and Barcelona, although the last months it's been more in Barcelona because I decided to be there for personal reasons, familiar reasons. And right now here in Barcelona, we are having a tendency of entering into a second wave. The cases are increasing and many things have been done, but maybe not quick enough, maybe not using all the capabilities that we could have used. For example, right now at this time, it's not working in our territory, a contact tracing app, as in other countries are working. And in many other countries, the apps theoretically are working, but then there is not a real implementation. So many things that could be used and haven't been used properly, etc. But let's make a review of what could be done with all these things. Digital contact tracing apps. This is a concept that was very strongly advocated by international organizations at the beginning of March, and still it's advocated. But as you know, it has evolved from single apps to maybe more native solutions. The API of Apple and Google allows governments to make an agreement and to secure the connectivity, the connection from the API of Google and Apple with the servers of the healthcare system, just to be sure that the codes that are sent in the case that somebody has been in contact with another person more than 15 minutes, less than 2 meters away, are sent by the health authority of the country. But in March, it was thought that maybe we would need 60%, 56% specifically of population to have a model where to have a good quantity of information and to reduce the curve. However, now we know that, and we were talking about different types of digital contact tracing apps. The ones that we had in March, now we have this more native application, and now we have more knowledge. And now we know that even maybe with 20 or 15% of downloads of population, the modeling systems are saying that it could help a lot to know a little bit, to help with the telephonical contact tracing. I think it's important. Also, it's important to know that there are many new tools that are working. They're working to find out a little bit what it's called the RT. Right now we know the reproduction number, what it's called the R0. Now this is the information that you have from the last 2 weeks. How it's
exactly. I'm sorry to interrupt. Can we have full screen, please? PowerPoint presentation full screen.
Yes, sorry about that.
It's all right.
Sorry.
Thank you.
Sorry about that. Yes. Right now the R0 it's the indication of the capacity of transmission. As you know, if it's bigger than 1, you have a problem. If it's less than 1, the pandemic is under control, because it means that one person transmits to less than another person the disease. If it's bigger than 1, it means that one person transmits to more people than 1 the disease, and then it's exponential. So we want ours to have the all population under 1. But right now with these contact tracing tools and other methodologies, we can calculate that. We want to develop tools that calculate the real time, not the R0 of the last 2 weeks, but the real time reproduction number, which these digital contact tracing apps would help a lot in that sense. And even we should think in developing tools that they would show us the prospective reproduction number, which will be the number with the real tendency and with the real numbers that we receive from the digital contact tracing app. That's why it's very important, as although many governments have implemented contact tracing by phone, which is correct, it's well done and it has to be increased, No, by the way, Germany, for example, I believe one of the best countries in implementing rightly the policy, no, have 5 telephonic human contact tracing persons for 20,000 inhabitants. No, this is a good ratio. No, but many other people have maybe 1 by 200 or 1 by 150. It's not enough. We need more. So the digital contact tracing app would be a good complement of all this policy. No, and if we have enough data, we could start to calculate the prospective reproduction number. I think it's very important, and that's why even if some countries believe that the more or less situation is under control and the telephonical contact tracing team members are enough, it's not enough. The more information you have, the better. No? And I think it's important via an app or via the native solution of Apple and Google, which, by the way, the app also uses the native solution, the API of Apple and Google. There are also other alternatives, but I think it's a good solution to implement to start having more data with us. No, the working hypothesis, as I have explained, is that you would have a mapping, no, of this number of people that have been in contact, and the situation model. It has been changing, but now it's perceived that with a 20–40%, it could be enough to really have good numbers and modeling. It's very difficult to achieve 60%, as it was told initially, but for small countries or countries where population really follow well the mandates of the government, I think it's a wonderful solution and should be implemented everywhere. The tools, any digital contact tracing tool must have a depth of approach, which it means that basically you need to be changing, iterating constantly, no? Constantly the tool, always talking with the final users and so on, and iterating very quickly, following the guidelines of international healthcare institutions, if possible, and so on, and perceive by the population as something that is not tracing them, and it's voluntary, non-discriminatory, and so on. This is every country is different, every population is different, but it's very important that it's, if possible, it's perceived as a good opportunity, no, to start using digital health, even if a government is not convinced that the amount of resources, which, by the way, having the API of Google and Apple, the amount of resources, it's minimal. No, it's having a development team of 3–4 people for a couple of months for developing, if you want, an app on top of the API of Google and Apple, or if you want to use the native scenario directly, it's just a question of linking that with the servers of the healthcare institutions to be sure that the code is sent by the healthcare institution. No? But it's really worth it, because it's a first opportunity where citizens can really see that the governments are taking care of them, and there is no way, if it's using that Google and Apple API, to really track people with this app, no, or with this native system. Artificial intelligence. I think it's very important that when we talk about artificial intelligence, no, we are able to explain to our citizens, to our partners in our projects, to what is data, what is machine learning, what is natural language processing, speech recognition, persistence, because people put in the same umbrella everything. No? And I like to develop this kind of graphics where we have a main stream, no, a main root of concepts, then subdivisions of specific concepts, no, and then final tools, no, final tools that are used. No, I think it's very useful, because that symptom checker is using that other tool is using that other thing. No, or for example, if you do, that's not the case today, but if you do it in a nice way, you explain to doctors what a CNN is, no, which is not this TV channel. No, CNN is a convoluted network, no, which is a type of natural language processing capacity And this is very important, no? At least because if we have doctors away, if we have like two walls, no, doctors, healthcare implementers away from the engineers, I think it's a missed opportunity. I think we have all to work together. No? Here we have, for example, Medictor. It's a triage symptom, like the ones, as you know, maybe Ada Health or Babylon or Infermedica, and this is Medictor. These four are the most well known in Europe, and these are tools that are using predictive analytics in some ways, and so on. No? IOMED, it's a nice company that has been using natural language processing to increase the recruitment capacity, of pharma companies in randomized controlled trials. As you know, many hospitals have the clinical histories. Sometimes, of course, it has changed all the time, but even if they have a digital system in place, the information in the electronic medical record is not structured. It's information that it's not used in the correct flow or with the correct formulas and so on. So it's written in the history, of the electronic medical record. So this company used natural language processing to structure the unstructured information, and to then deliver that information to the pharma companies with the permission of the hospital to say, oh, in this hospital, you could recruit more members for the clinical study, which, as you know, this is very important to have new members in a study, in that sense, because it's the most expensive thing to recruit effective members of a study. CardioCube, voice recognition with Alexa, with other devices, speech to text, text to speech recognition. You know, many companies are working on that. Voice recognition for heart failure. As you know, with heart failure, you have increase of liquids in your body, increase of liquids in the legs, but also in the cords. And it's developed some algorithms where you can detect a change in the tone of the voice, which would then trigger an alarm, say, oh, there can be possibilities of having heart failure. That could be even more accurate than the measurement of the weight of the person. And that could be interesting in this time of COVID to really avoid new stays in the hospital and so on. So all these technologies in these last months have been accelerated at huge velocity. DeepIMed, a colleague of mine, Oleg Vorontsov, talked about that, I think, yesterday. Many tools that really use AI to structure and to collect and to offer knowledgeable knowledge. I think it's important that you have huge amount of data. You convert that into a vectorial element, but then these things must be added and create knowledge if possible. Because if there is not the right hypothesis question, if there is not the right information itself, it's not enough. We have to really create systems where AI is used to create knowledge. Because, by the way, knowledge is better because knowledge it's not needed to be GDPR compliant. One thing is data of people, but it's knowledge of this data. I think it's very important, and this type of companies are very important to do that. Many other tools, but very important is the approach of having them in mind what can be done with that. Artificial intelligence in general in global health can do many things, but as I was talking before, speech generation, many doctors have stopped writing this last month. I think it's important. There are many companies like Dragon Health and other companies that are really helping, so doctors don't have to write anymore. And when a doctor stops writing the clinical history, they never go back. I've seen it with my own eyes. It's important to give them more quality time that they can see, and they can look at the patient and focus in the patients and stop spending time in that sense. Many things can be done with artificial intelligence, but if I like to point out different colors. This graphic that was done by Bill Gates Foundation, Rockefeller Foundation, and a scenario of where we could use artificial intelligence for global health. And in that sense, many of these platforms can be used now for population health as a virtual assistance, health assistance. Very important now if we don't want to touch patients, want to have them at home as long as possible. Virtual health assistant, you can have chatbots that can really prepare your visit for you and really can be in a waiting room, in a constant waiting room process where if there is something, if you are asthmatic, or you have a pulsimeter connected and basically your saturation is under 95, for example, then the chatbot could open the waiting room, no, and have communication with your pneumologist. If not, then you should wait, and so on. So there are many opportunities to regulate, no, the communication with your healthcare workers, your doctors, nurses, and so on, in the right moment, and give a room for the other time to be talking with chatbots and so on. No? Physician clinician support tools everywhere in the world. We should have capacity to have a symptom checker, a decision clinical support tool for the doctors, by the doctors if possible, with the contribution, but also for final users, no? Final patients in that sense. Not strange to see that many pharmas are really buying a lot of companies or collaborating with them. And now that the virtual trials are happening at home, that acceleration is even bigger. No? Specifically for COVID, we're lucky to collaborate with some projects. Some of others are here. I've decided to put some of the projects of my city for obvious reasons, but there are multiple cases in different cities of the world where artificial intelligence tool has been used to reduce, in that case, mortality. In the hospital clinic of Barcelona, it was used to collect data of more than 450 patients at the same time. No, that was in the moment where the hospital was totally overwhelmed. The hospital changed, and there is the biggest hospital, the most important hospital in Barcelona, with Hospital Vallebron. In that hospital, all the beds of the hospital were dedicated to COVID. And in that sense, even with the best trained doctors and with the best capacities, it was impossible to be on top of all the patients at the same time. No? So it was a system was implemented to really have the data, the real-time data of all patients, and also every 3-4 hours blood data and so on. And in that sense, I didn't participate in that project, they achieved a mortality reduction of 50%, no, in comparison with the patients before the implementation of that solution. Of course, along the weeks, the knowledge of the disease improved and many other things, but it was very helpful to predict and to advance the treatment, just establishing some patterns and using some artificial intelligence platforms. Of course, for chest X-rays and many other tools, a lot of companies are working on that. Very interesting, the approach of pulmonography or echocardiography or echography, sonography in general, as companies like Butterfly Networks and other companies that are really developing sonography devices for just under or even $2,000. And then they are offering, a package of cloud of diagnosis package tool where people can really detect if they have the typical interstitial bilateral interstitial front, which really is it's a conclusion of the disease. Many opportunities for GPs going to homes of people, of course with protection, but to really explore with sonography if there is already some condensation in the lungs, because then the acceleration of the process of sending these people to home and not the others, so on. So many interesting studies, and of course all these images sent to clouds, where a lot of people are competing and collaborating in competitions to diagnose all these things. No? Very, very interesting approach. WHO launched, we were lucky to work with WHO in a chatbot for a while of tuberculosis and so on. We've been working for 4 years in that bot, but that was a bot developed quickly by other companies, impressive working with WHO, and they developed the first digital worker to help people quit in tobacco. No? It's a very, very, of course, visual image of the bot. No? In that case, it's a feminine bot, but it can be adapted. I think it's important that we use the technology in such a human way as possible. No? AI is important, but it's super important that really people in the hospital know what they want, or people in the institution know what they want. No? And in that sense, to formulate the right questions, it's super important. No? And to create templates, no, where you say, we want to really structure the information, and we want to really achieve this template, no? And because then we'll be able to analyze and to find patterns, no, with others. I think it's super important, because if not, we're just looking a needle in the middle of the ocean. No? I think it's important that we have this capacity in the hospitals, with the people that works with ICD-10, now ICD-11 has been launched by WHO, SNOMED, semantic terminology, concepts, no, electronic medical record. So that we have these teams in the same boat with the physician, with the clinician. No? If you know as a clinician that on the third, 6th, 7th day, no, of COVID disease, no, there is a peak of X, Y, or Z, no. So then it's important to break down the information, no, with these concepts, no, and to look for that information, no, in the big data, with using artificial intelligence and so on. And then also, because by breaking down these elements, you can then, for example, play and say, oh, can I use AI to scan all the articles that have been launched in the last week, no, of April, and then with that information, can I really target the specific treatment in a, yes, you can. And that's why it's very important to do the right hypothesis, to be working with people that normally use semantics with artificial intelligence in our fields, but it's a multidisciplinary team. It's a multidisciplinary team, data scientists and many other people together. If not, it's not like I put any piece of information and the artificial intelligence will give me the answer. No, it's good hypothesis and the right professionals working behind them. No? Sorry that this is an app that was repeated here. Slide, sorry. And big data. Big data, it's about, as always, it's how you use it, the quality of the data. That's why you need data scientists, but especially, again, with the good hypothesis at the beginning, and obviously not having any silos in these moments that we need to collaborate. Obviously, many regulations have not been followed in the last 6 months, 8 months. We have been able to innovate because we really broke many of the legislation, many of the things. Now it's time to remind governments that they should make legislation that facilitate these innovations that we could be able to implement in a quick period. No, but it's important to mix a lot of data of different things and to allow citizens participate, if possible, in that big data. No? Very important if you have different technologies. So to really show them in a nice way. No, I think this groups of people using different technologies, of patterns of people, patterns of different technologies. It's important. There are different countries that have made lists of which companies in their country are working in A, Y, and Z, and I think it's a good example of how to do it. No? This is a nice example of what can you do, how you can make brainstorming and try to do things. No, we are now working, our company, a lot of, with a company that is, we're working in co-knowledgeable, and we're working in transforming the information that the people in charge of the residencies, older people residencies, are receiving from the government, from the scientific magazines, from the international organizations, all the information that they are receiving, no? Which is a lot of information. Some of them it's basic evidence-based medicine information, some of them are protocols, some of them are regulations, no? And how this thing finds a total gap, no, with the real measures that they have to implement, or the real measures that they implement, are they following the totally constantly changing, no, rules that are changing the base medicine? If one day a room with two people, but they are, it's of course forbidden from the beginning, but if some magazines say that if the two beds they don't mix each other and there's no other necessity, they can live together, but just at least 5-6 meters. But then now we know that obviously the transmission by small and tiny particles is there probably, so it's not possible. So it's a mess to have a dashboard, a control managing dashboard of the measures taken with the amount of regulations and base evidence literature. No? We have started with a single specific case in residencies, but we will translate that to hospitals. To have a dashboard using artificial intelligence, collecting a lot of data from different sources, using natural language processing, and then transforming the vectors in a what we call a pentagon, a knowledgeable graphic, and then increasing the knowledge, no, of the people in charge of residencies, of hospitals, and so on, and comparing the gap with what we're doing, what is it over there. I think it's super interesting. We are open to collaborate with any government institution that wants to do things. And from here, we foresee many other ideas of reducing the gap, no, in that sense, of knowledge available and implementation from governments. No, I think it's super interesting. Many innovations there. Our coronavirus, you have more than 1,073 initiatives that are very interesting, and we are collaborating with some of them. No, have all these integrated also in this amount of information I was telling you before. And so we are doing that, breaking down. Very interesting to collaborate with huge initiatives by UNICEF, of all United Nations institutions. UNICEF is really the most innovative, especially the headquarters in New York, but they have achieved that really the national offices of UNICEF really propose innovative projects. And well, I can say that during COVID time, there have been like more than 20 initiatives implemented by UNICEF, and I think we have to congratulate them because it's really massive. I believe countries should work a lot with UNICEF, I think. Finally, in that context of our company also launched a wonderful project called Epidemics, which was initially was an initial website where we just have 1.4 million visits in just 3 days. At the beginning, between 7th of March and 10th of March, the first initial days. Then we transformed that in Epidemics TV chapter. But then it's what we're launching now, right now under the umbrella of studies for COVID, but transforming it in epidemic analytics, epidemic studies. We are developing a platform that will allow researchers to post their study, to use our web app in a freemium way for free, as long as they put the data in an open way, and also to have crowdfunding or donor funding possibilities in the same platform. No? As you know, researchers use many tools. Let me show you here. That tool that we developed, it was used for the first seroprevalence study made in Spain. And we use that platform, and now we have put at disposal of all researchers platform for free, pro bono, as long as they put the data in an open format, so other researchers can really take advantage of that, and then they can post the study in the studies for COVID, that now will be rebaptized as epidemic studies, and then also ask for money for their study. I think it's super interesting. This is a serological study, different ways of showing the open data, because I think it's very important that what you do immediately is seen by others. And as you see, many different epidemic studies, many different studies, at disposal of final population to fund them, final donors, and with all online data, to be seen with crowdfunding buttons, some aspects, some funding. And I think that would be all from my side as initial talk. And if anyone has some questions, it would be a pleasure to answer them.
Thank you for the nice presentation, Dr. Jordi. It's been great pleasure to have you with us. We are really interested in learning more about the applications, and probably ask you to do another demonstration for the society when it comes to the different apps that has been developed. Probably we also would like to cooperate with you, because there is so many things that you've been talking about be related to raising awareness of AI apps here in the kingdom, and we would like to learn more from your experience and add the implementation of Arabic languages and to whatever you have, especially when it comes to speech recognitions, deep learning, and other things. My question now is, how do you think your application have assisted your government against COVID-19? Thank you.
Thank you. Sorry, I lost you 1 second. How I believe, or different tools?
My question, you have developed different apps,
yes,
against COVID-19.
Yes.
And we know that Spain is one of the countries that was hit badly by the epidemic. So my question to you, how your apps and your technology have assisted the Spain government against COVID-19, and is there any measurements that you can share with us, for example?
Yeah, thank you very much, Anna. Yeah, that's a very great question. Sadly, I'm very honest. We believe that Spain is divided in 17 autonomies, and every autonomy has power for healthcare. Of course, the federal government, the central government has taken the power now for the epidemic, of course, for the pandemic. But sadly, not only us, but other companies, the government has not taken advantage enough, still, from all the possibilities of the technology. Even the big radar COVID app, which is the implementation of the API of Google and Apple for all the Spain, it's only implemented in some autonomies, not all. And in a specific case, yeah, we have implemented this.
No sound, doctor. I think you put yourself on mute. Dr. Jordi, you have put yourself on mute. We cannot hear you. We cannot hear you. We cannot hear you, Dr. Jordi. Can you listen to me? Can you hear me? Saudi mobile host, please, can you do something? We cannot hear Dr. Jordi.
We haven't done anything. He is unmute.
No, he was mute. Dr. Jordi, can you hear us now? We cannot hear you. You are on mute.
He had some technical difficulty in the beginning also.
Please send him because we cannot hear. Try to communicate with him. We cannot hear him. I cannot unmute him.
Dr. Jordi, Dr. Jordi, can you hear us? But we can't hear you, sir. Yes, sir. No problem. We will wait, sir. Dr. Jordi has replied us that he will connect back to us in phone. So please hold on for a couple of minutes.
Hello?
Hello, Dr. Jordi?
Hello, can you hear me now?
Yes, we can hear you now.
Oh, fantastic. Sorry about that. Fantastic. So fantastic. I was answering Fatma's question. Fatma, do you hear me?
Yes, I can hear you. Yes, we can hear you again. Thank you.
Fantastic. Thank you very much. Sorry about that. I don't know what happened with my computer. So no, yeah, it was it's not enoughly used our technologies, not only our company, many, but now the government is understanding that they have to put any single technical possibility in that circle, no, of all the possibilities. Telephonic contact tracing must be included with contact tracing apps, with self-symptom checkers of patients at home. Everything must be used. And especially, yeah, the tool that I was speaking to you about the residencies that we're building and so on. Yeah, we have a lot of expectation from the government to start using it as soon as possible, no? Because I think it's important.
Thank you for answering the question. It's really nice. As I mentioned, we would like to see more about the technology and demos and see how you've been implementing this to assist human and to help progress the health sector as well.
Wonderful. Thank you very much. We can set up a new meeting if you want.
Yes, we will decide with each other.
Wonderful.
Of course. Thank
Wonderful.
you.
Thank you. A pleasure for everybody. A pleasure. Thank you everybody for listening to me, and thank you for the invitation.